Welcome to the Hard Things About Healthcare, where we get into the business and operations of healthcare that clinicians face every day, the challenges they present to delivering care and running clinics, and how they overcome them. The Hard Things About Healthcare is brought to you by Honey Health, the connected care platform for modern healthcare teams. I'm Matt Faustman, type 1 diabetic, and co-founder and CEO of Honey Health.
I'm Ginger Vieira. I've lived with type 1 diabetes for 25 years. I'm a diabetes author, speaker, and content specialist. On today's show, we welcome Dr. Qudsia Hussain. She is board certified in endocrinology, diabetes and metabolism, internal medicine, and obesity medicine. As an active member of the Endocrine Society, American Association of Clinical Endocrinology, American Medical Association, and American College of Physicians, she is dedicated to advancing endocrine health and enhancing patients' quality of life. Dr. Hussain, thank you so much for joining us and for discussing the challenges in healthcare that you face as a clinician, as an endocrinologist.
Thank you for having me.
I want to jump right in and ask you, how did you choose diabetes? What led you here?
Yeah, so admittedly, I was always that little kid who was interested in science, doing science projects for fun, picking up rocks, looking for like answer needs. So I always found science to be interesting, and then from there, the human body and how it works was just always fascinating to me. And so I ended up, sticking with my passion in science and majoring in biology in college. After that, I went on to pursue my master's in public health, and I would take these community health courses. And I remember just being mind blown at how prevalent chronic conditions such as obesity, diabetes, cardiovascular disease are, and how little is done to prevent the progression of them and their complications. And so, honestly, taking those courses, I felt a little overwhelmed. Like, how was I going to make a difference in healthcare literacy, or in, improving social determinants of health, or in, the food industry, in healthcare accessibility and affordability. And so for me personally, I felt like becoming a physician and treating patients with these chronic conditions such as diabetes was going to be where I made my change. And so really treating patients with diabetes for me has been really rewarding, because I get to work with them to improve their quality of health and make significant impact in their overall health, and just form deep connections with them, and walk them through their highs and lows. And so I really am happy with the choice I made, but I felt like every little component of my life sort of led me up to making that decision.
Do you have moments of feeling totally overwhelmed with, just because we know that obesity and diabetes rates continue to climb? Does that feel overwhelming as kind of on the front of this battle to try to help?
Oh, absolutely. So, in the US, adults over age 20, 42% live with obesity, and 11.3% of the US population has diabetes. And so the wait time to see an endocrinologist is so long. And there's obviously continuity of care. So I'm seeing those patients in follow up. And so it's hard to even, schedule new patients in. And then, there's so many people waiting to be seen that it can be really challenging and overwhelming, because you want to sort of get to everything. But you can't always do that. And so it is tough with those numbers. We're seeing it more and more. And now there's like a push for, which is, I think, a good thing. People are becoming more aware of their health and their numbers and what that looks like. And so, patients who have prediabetes will want to come in and sort of address that instead of just, full-blown diabetes. And so there's a lot more awareness. And I think that also causes, there's more patients who want to see endocrinologists and be seen.
Okay, which of course is a great thing, but then creates more demand on an already limited supply of endocrinologists.
Yeah, definitely.
Kind of on that note, really interesting in terms of like, one of the challenges is you want to see more patients and you want to have more visits with the same patients, so you can have that continuum of care. Endocrinology, one of the things that we've heard from more and more clinicians that we talk to is it's extremely data intensive. There's so many patients. So there's a lot of challenges that come with being an endocrinologist in this day and age. And so what are some of those challenges or the biggest challenges that you sort of run up against when it comes to your days or patient care? What are some of those major challenges that you're really facing right now?
Yeah, so I mean, as you guys know, the advances in diabetes technology is insane, right? And so a typical visit for me with a patient who has diabetes is integrating continuous glucose monitor data with insulin pump data, with lab values that include, the A1C, which is the diabetes marker, cholesterol, kidney function, electrolytes, and then the vitals, so their blood pressure, heart rate, temperature. And so I'm including all of that information, plus trying to be present and listening to the patient in less than a 20-minute visit, and doing that 20 times over. And so, and then with the documentation, all of that combined does become very, very challenging. And to explain complex data trends in a way that's meaningful to the patient and empowers them without overwhelming them is kind of an art, and it's tough to do in such a time crunch. And so I do find the data to be excellent, right? And so we've come a long way from vials and syringes to now and taking insulin injections multiple times a day, to now inhaled insulin, to insulin pumps that will deliver insulin for you, and from finger sticks to these continuous glucose monitors that tell you your blood sugar all the time. And so we've come a long way, and that data is great for patients. It's great for providers, but there's something to be said about the humanness of diabetes care, right? And so I'm trying to get all that information. However, I also want to know what's going on in their lives. Are there any healthcare barriers, right? Are there breakups that are going on? Are they starting college? Are they about to run a marathon? Is there like a death in the family? All of this matters. And so to sort of combine all of that together is a little tricky at times, but and then just in the time constraints, it can be difficult, but we do it and it works.
Where are some actually said differently, are there solutions that you've come up with or tricks or things that you do when you're having to put that much data together and have to do it 20 times a day with probably only a few minutes in between? Like, is there a process or something that you've been able to do to help you, or technology that allows you to do that while also being present with your patients?
Yeah. So, I'm sure everyone does it a little differently. Every endocrinologist probably has their own little trick that they do, but I try to look at the data before I go in the patient room. So the first thing I'm not doing is staring at my screen when I see my patient. So I try to get that, because the insulin pumps have the pump downloads, all that information. I'm trying to look at, the continuous glucose monitor sensor readings, the lab values before I go in the room. And then once I go in the room and we chat a little bit, I'll actually, turn my computer around. So we're looking at the information together. And, I will say with all this health data, unfortunately, a lot of patients, do feel like it's kind of like their diary a little bit, right? It's like there's some shame surrounding some of this data.
Absolutely, yes.
Yeah. So I always make it very clear, like, this is not a judgment zone, and there is no, I am not judging you. This is just objective data we're using to sort of help you. And you can tell me, and they'll be like, yeah, that day I had birthday cake, and that day was this, and that's okay. That's completely fine. We're just looking at trends to help them. And I make that very clear, because as soon as I turn it over, I know they'll kind of squint, like, this isn't a good month for me or a good week for me. And I'm like, listen, no judgment. I totally understand.
I so appreciate that you do that, because many clinicians do not. And I can't tell you how often I see in the patient online community people just posting that they're about to see their endo and how nervous they are,
Right,
you
right.
know?
And I think some of it's from prior experiences, but some of it is like, sometimes we're tough. We're our own worst critics sometimes. And so
Absolutely.
and so
Yeah.
it comes from that too. And I'm like, listen, we're all human here, right? And so we can go through this together. And so usually that's the approach I'll take. And then so, the average endocrinologist spends about 14 to 15 hours a week on documentation and integrating this data into their notes. And so that's always there. I work Saturdays and Sundays doing it as well. And so that's how I sort of keep up as well.
That sounds that sounds like a lot.
Yeah.
Yes. That sounds hard to sustain too. That's not fair.
Yeah, it is a lot, but it's the patients that just when they do better, it's really rewarding, and so and I know it's so valuable to have this information for them and for me.
Yeah.
So you've touched on this a little bit, but so much of managing diabetes is self-management at home, right? I mean, it's like 99.9% what we do at home, the decisions that we make. How are you encouraging your patients to actively engage with their health data in their smartphone and what they have access to besides having the professional analyze it?
So, the number one thing is for me is to educate my patients like on their disease, course, whether it's diabetes or something else, they giving them that education, what an A1C means, what the blood sugar targets should be, when should a low be alarming, when should a high be alarming. That to me is like step number one, right? Because if you give somebody all this health data and now their sensor's alarming highs and lows and they're like freaking out because, and rightfully so, right? Because they don't know, they're not checking their blood sugars before then. And so we put a sensor on and all of a sudden they're like seeing all these numbers and they're like,
Yeah.
what
Yeah,
does this mean?
freaking out.
And what do I do about it, right? I was given this tool, but nobody ever told me now that my sugar's high, what do I do now to fix it, right? And
Right.
so it's really important, I think, patient education and to let them know sort of what to expect and to know that, I'm giving you this tool to help you with knowing your blood sugars and all this information. But, if sometimes sensors fail and sometimes, you have questions. And if that's the case, please reach out to me. You're not bound to anything. You don't have to have it on 24/7. If you feel uncomfortable, you can take it off and ask me the questions that you need to ask.
Do you
So
think, how many of your patients do you think are going into the back end of their data and looking at their time and range and looking at their graphs and the charts that that app provides?
Not many. I will say that those, averages and the time and range, I would say about 10-15%. But the day to day, just knowing their blood sugars and going by, the estimated A1C or GMI, they call it on there, they use that, I find more frequently.
Okay. Yeah.
Sounds like patient education is huge here. How are you able to successfully do that when you're in a 20-minute appointment with them and you have to review their data? You're also trying to create a personal connection and then also educate them not only on technology but then lifestyle changes, right? And I'm sure you're probably only able to get a few visits with them a year. So I guess a two-part question here: what are some of the challenges that you've seen with patient education, and where are some of the areas where you might have seen or gotten a little bit of success in terms of helping to successfully educate patients?
Yeah, so I think the most important thing is you have to meet people where they're at. You have to have a good understanding of what they know and don't know before you can, give them education about diabetes or how a sensor works. I try, if I feel right off the bat that a patient's coming to me and they're very overwhelmed already. They're like, I just got back from my cardiologist and I'm on a million medications now, and I don't even know what half of them mean, right? And so, like, I don't know what they do, and just, I'm just so sick of being on medication and my sugars are high, and I know, and I don't care. So if they start off there, then I know that we really need to take it slow. And so I'll, just really explain to them, okay, this is what diabetes is, and this is what why it's important. The why is really crucial, right? It's not just me giving you medication, right? It's because we want your blood sugars to be under better control, so you don't get complications of X, Y, and Z later on. We want you to feel better. You'll feel better if you control your sugars. And maybe up front this is going to seem a lot. But if you know a lot about your condition and what medications you're taking in the long run, even if you take it piece by piece in the long run, you'll be able to be more engaged. I always tell them, I want you to come back and say, actually, do you think we can go up on this and down on that? Because I want them to be at that level of engagement in their care, because I find that to be the most successful. This paternalistic approach to medicine of just telling patients what to take and what to do, I don't really believe in it. I really believe in shared decision making and asking patients, what do you think about this medication? I recommend it, but I want to know what you think and what you feel about it. So I think in terms of education, really just seeing what their healthcare barriers are, what their phase of like, are they in the pre-contemplation, contemplation, what phase of change are they in, or like are they ready or are they not ready, and how much are they willing to consume of the information that you're giving them. So I try to do it piecemeal. You're right, the time constraints are tough. And I'll tell you, Matt, I'm running behind a lot, but we make it happen. We make it happen, even if it's a little chunk at a time. It gets done, and I think honestly, being personable with patients is probably the best way to get through to them. Just be honest at the end of the day, just being a human.
Yeah, so they feel like that their time with you matters, and that they feel and understand that you do care about their well-being. I mean, that's priceless.
Exactly.
One of the things that we've heard from other clinicians as far as like working with their patients and all of these technologies that are coming into their hands is sometimes just like getting their data prior to that their actual appointment, right? That 5 minutes that you have beforehand or 10 minutes you have before an appointment to actually be able to see their data. And one of the challenges that we've heard, not just from large health systems, but also from private clinics, is getting patients to either connect their data or upload their data or send their data over. Is that something that you've dealt with as far as a challenge of getting that data? Maybe it's even lab data because something's not connected up. Have you experienced that challenge, and where are the areas where you're really seeing it, and any thoughts or solutions for solving that? Because it's a ubiquitous challenge across every endocrinologist that we've had a chance to talk with.
I, forgot about that until you mentioned that. I literally day in, day out experience that. It is probably the most frustrating part and challenging part with this. I'm glad you brought it up, actually. It is so challenging because, you're like, the username and password, and they're getting logged out and it's incorrect password. But some of the continuous glucose monitors, when they're logging in, they just can't get in and they're getting kicked out. It sometimes, even with the pump downloads, takes forever to get those, and you're like, that was 10 minutes of a 20-minute visit. So So I've learned how to sort of like now circumvent that. We don't do that anymore. So what I'll do is, if it doesn't happen within the first 5 minutes, the pump itself will give you some information. The patient will give you information. You can, sometimes those apps that tell you about the continuous glucose monitor, they'll give you information. I just at that point will take it into my own hands. I'm lucky that I am very, skilled with technology, because I can't imagine, being a provider who was not, and because with all this new technology that's coming out, I'm able to say, hey, do you mind if I borrow your phone for a second? Because half the time they're giving it to me. They're like, what do I do? And so I'm like, let me just take care of this really quick. And I'm able to log in for the most part. I'm able to get the information for the most part. But I can't imagine if I was, not good at that. And so that would probably be another big obstacle. But that's a huge part of it. I would say that happens like 50% of the time. Actually.
Wow.
Yeah.
Oh my gosh. One of the kind of traditional solutions here is to have someone on your team, maybe an MP or a physician assistant, to actually reach out to patients a week ahead of time or a few days ahead of time if they don't have any data logged. Is that something you all have tried? Is that and has that been successful, or do you still run into challenges even trying to do that more sort of manual effort to reach patients and get them to add some amount of data, or even like try and connect their data to the clinic?
So I always think about how we can sort of troubleshoot, because we do have a clinic code that can connect with patients,
Yeah,
right?
sure.
And so we could definitely have that set up and ready to go beforehand. Um, a lot of times, because endocrinologists have such high volume of patients, you're usually working with a staff that's very overworked, and they're doing a million things at once. And so for them, if we could do that, I think that would be the best way to troubleshoot that. But I have to say, it's difficult for the staff to get that data beforehand. At least where I am, where all of the providers are seeing 20 plus patients a day. It's tough to do that. But I will tell the patient moving forward, if it's like a login error on their end, like, please, let's work on this together before the next visit, and if you run into any trouble, let me know and I'll help you, because that way I can see your numbers, and then we can have a productive visit and figure out what our next steps are. If I have issues with pump downloads, I'll ask the reps for the medical device reps, and moving forward, we'll fix that problem and make sure by the time the patient comes back, there's no issues.
I'm curious, you mentioned earlier
Yeah.
more and more patients who have prediabetes, right, who haven't been diagnosed with type 2 yet. Are you seeing yet people coming in with the over-the-counter CGMs?
Yeah, so now they have Stello, and so there's some over-the-counter CGMs that are available now, and so or they'll ask for CGMs and ask if they're like good candidates for one. There's a lot of information now via Instagram and TikTok where people get their information. So I'm seeing like a lot of patients who ask about their cortisol levels, their thyroid, the different endocrine hormones. And are wondering, do they have insulin resistance, right? Because we hear that a lot now. So I get a lot of patients who ask me about all of those things, and wearing a continuous glucose monitor as well.
Cool. Okay. That's exciting, because that could really, I've put a CGM on a couple friends who suspected they might have prediabetes. I had some extras, don't tell. And they did. I mean, they were really motivated by the information they were seeing just from the basic data coming in on, the main screen. They were really motivated by seeing those numbers. So I hope that more and more people can get access to that data through those over-the-counter options.
Yeah, definitely.
We talk about being overwhelmed. If we add prediabetes into the mix, what is that, another 50 million Americans? Is that
Right.
right?
It's really and it's crazy because it's so much, right. There's some diabetes clinics that are like, unless you have the diagnosis of type 2 diabetes, we can't see you, because they are just so overwhelmed, right? They're like, this is a primary care issue. And so, yeah, I mean, the CGMs are wonderful, but they're a little bit, for some patients, anxiety provoking too. And so if you're giving the general population sometimes these continuous glucose monitors, yes, it gives you really good information about how certain foods affect your blood sugar, how stress affects your blood sugar, all of this good information. But there's a 12% variance from the continuous glucose monitor to what your actual blood sugar is. So if you don't have prediabetes and your blood sugars are completely normal, then it's alarming low, and so it's tricky to not also cause too much, give people too much information that might cause anxiety too, because sometimes you can get overwhelmed with the amount of data that these devices provide.
Yeah, and if they were to Google, I have a friend who she's Googling, oh, normal blood sugar is 90 or something, but she's seeing a 140 after dinner, and she's fine. You know what I mean?
Right.
But she's freaking out, and so there's that education component is not coming through over the counter necessarily.
Exactly. Exactly.
You had talked about having to work on Saturday and Sundays, which as an entrepreneur, I feel you. We're doing the same thing, and so much of this is charting and having to work in the EHR and having to deal with, maybe it's having to also deal with all of this data. Where are some of the areas where, and we just call it busy work. It's important. Everything we're doing is important, but it's just like busy work. What is consuming the most amount of your time in areas where you would like to see sped up, or you've done some things in those particular areas? Like what are the top like 3 things where they're just a lot of busy work? It's not patient care, right? But they're things that you have to get done either to finish your work, get paid, whatever it may be. So what are some of those like major areas for you?
Definitely, documentation is probably number one, and then after that is insurance companies, and getting rejections for certain medications, doing working with my staff for prior authorizations for medications, and letters of appeal, talking to other physicians of insurance companies for like peer-to-peer approvals for certain medications. That's very time consuming. I would say, otherwise, what I'm doing on the weekends is a lot of patient portal messages. So the patient portal makes this very accessible, and that's tricky because I love, that it's part of patient care and it's really important, but it takes a lot of time to answer a lot of those messages. And so I would say documentation, healthcare, insurance companies, and just dealing with medications being rejected, or I get sort of these little like, this is how you should prescribe your medication for this patient, or this is what they should be on, which is not, and it's like you've never met the patient, right? And so it's kind of crazy and insane to think about, but that's probably where most of my time goes.
So
Can you
frustrating.
open up documentation a little bit? I mean, and I know this is something that you live and breathe every day, but like what are the big pieces of documentation, right? And what are the areas that you need to focus on and need to make sure that they're right? And is that for your own continuity of care with the patient? Is that for reimbursement purposes? And I guess, can you kind of break it down into some buckets in terms of like documentation, and where are the areas that are like really, really time intensive for you?
Yeah, so I have to pull data from the lab results that come back. I have to make sure there's a physical exam, vitals into the chart. I have to make sure that if I'm reviewing the insulin pump settings, it's all in there. And then on top of that, our conversation, about X, Y, and Z medication, their risks, side effects is in there. And then also the time I spent with the patients, I document that, and also just billing too, making sure the billing is correct for the documentation and for reimbursement purposes. So it's a lot of just having their medications updated, their settings in, their data in, and what we talked about, any risk side effects, and then also just making sure that billing is accurate.
It's a lot.
Yeah, it's a lot. Sometimes I think about how much goes on in one visit, and I'm like, I don't know how that gets done, but it gets done.
Yeah, I think about even just my own recent visit with my endo once a year, and I don't really need, all I needed was I wanted to ask about a new CGM technology, right? But we still have to spend 15 minutes going through all the medication doses and everything that that's not what I needed from her, right? And it's incredible how much time is consumed.
Oh yeah, yeah. It's a lot, and I'm sure you know you experience it too. But a lot of like typing while you're there at the visit, and
The whole
that's
thing. Yeah.
yeah. It's tough. You like I wish I could have more time to just sit there and be more engaged too. But I'm always thinking, if I get half of it done now, I don't have to do half of it later. So
Yeah,
Yeah.
right. Your time matters too. Yeah.
On this whole note of kind of the busy work that you have to do, the other category, which I was a little surprised to hear that this sounds like a really time intensive area for you, is on prior authorizations. And it sounds like haggling with the insurance companies over the right medications to be giving to your patients. Can you open up that a little bit? I was a bit of surprised, or a bit of a surprise that that's an area where you have to spend a ton of time. And like, how are you managing that, and how often is that coming up throughout the day? Like, for every 20 patients you see and you have to submit a new medication or a refill, whatever it might be, how often are you running into these barriers with kind of this back and forth with insurance companies or prior authorizations?
it's so often. I feel like every time it happens, I have this like inner rage. It really, it just drives me insane that I just can't wrap my head around. I'm seeing the patient. The patient and I are working together. We've come up with a plan, and now we know what medication is good. We're going to try and what works best. And then you have someone say, no, I think this one's better. And this is because, we're going to cover this one. Or you haven't gone up on the dose of the medication. And so that must mean it's not working. So now we're rejecting it because you didn't titrate it and you didn't increase it.
Wow.
And I'm like, are you kidding me? You're making me increase a medication that we both don't want to increase. And now you're rejecting it because I have not increased it. So it's a lot of, back and forth. I'm trying to, thank God, I do have a good team that really just, that's so, healthcare is honestly, you are a part of a team. It is a team effort to get things done. And if you have a good team, you're only as good as your team is in terms of the front desk, your medical assistants that you're working with, the nursing staff, everybody's trying to, keep patient care at the forefront. And so we're able to get a lot of the prior authorizations done in a timely manner, but there are a lot, and they make these forms and they are so cumbersome that it's time consuming, and it's really time consuming on everyone's end. And for me, I feel it's unnecessary, but, I guess, I don't, that I'm not sure, how we could work around that.
And I think you're right that a great team, helps us to get so much done. That resonates a lot with me. What are some other things that you found successful in the back and forth with insurance regarding medications? Is it you just don't back down and you just keep, pitching your case, or like how can you open up, like how does your team actually get this done consistently, thinking of the patient in mind? Like, what are some of the things that they're doing or you're doing to ultimately get these things through?
So we know that there are some keywords and buzzwords and diagnoses and comorbidities that we can document and sort of, or like, to mention, patient tried X, Y, and Z medication and failed those medications. So let's, try this one. And so documentation is key. So I'll try to, incorporate as much documentation to support them getting this medication or the continuous glucose monitor, right? Many patients don't have access to it, and it's crazy to me. So I'll try to do documentation. If all else fails, I want to talk to somebody. So I'll ask to do a peer-to-peer, and I'll say, here's my cell phone number, please call me. And so, I find those to be very helpful.
It's harder for them to say no when they're talking directly to you, and they have to acknowledge that this patient's doctor is saying that they need this medication.
Yes, and often it's a pharmacist or another physician. And so if I tell them the full story, they're like, okay, that makes
Mm,
sense. But you can't always do that. And so it's tough because it's like these papers back and forth and they're faxes,
Yeah.
right? And people know that things get lost in fax world. So
Yeah. And if you have to call, then you get put on hold. And if it's with an insurance company, you're on hold for like 10 minutes.
oh
And
yeah.
then you talk with someone or even pharmacies. So that's just more time that
and
you
the
don't
insurance
have.
companies don't have any incentive to improve this because they don't want to cover, they don't want to make this easier for you or the patient.
No, no, no.
This is deeply broken. The people that are causing the problem are going to be the ones that want to fix it, and that's not going to happen.
No, and half the times, the forms don't even make sense. I'm like, this makes no sense. And like somebody from the medical field did not design this form, so I can't even answer these questions.
Oh,
That's
no.
terrible. Yeah.
Dr. Hussain, what is the best part of your job? What is, or even a best moment that you can remember without, of course, revealing private patient information?
Yeah, the thing I love about diabetes is this continuity of care, right? And so when I have a patient who is a new patient who's been on insulin for type 2 diabetes, has been on insulin for years, right? And has been dealing with weight issues and cholesterol issues and this is just an example, and I'm able to offer them new medication and like GLP-1s and technology, and give them some, and educate them about their illness and all these things. And then I see them in follow up, and their A1C's, going down, and they feel better, and their cholesterol's better, and their blood pressure's better. That to me is just really, really rewarding. When they're happy, it just makes me happy because we did something right and together, and it changes. I think getting my master's in public health, I realized how important preventative care is, and we don't do that
Yeah.
enough here. We don't focus on it. There's not a lot of reimbursement that goes towards preventative care. Only on fixing things and stenting an artery, and if that's of a patient who's had a heart attack, but not prevention of a heart attack, right? Not prevention of stroke. And so I see that, and so for me, I feel like it's really impactful to start at controlling these chronic conditions, and so we can prevent these complications from happening in the first place. And so to me, that's really important.
Well, thank you for continuing with the persistence to try to make that happen when everything feels like it's against you so often.
Yeah. I love that.
Of course.
Well, thank you so much for joining us today and taking the time out of when you probably need to be managing charting and documentation. We are greatly appreciative of your time.
Of course.
Thank you so much.
Thank you guys for having me.